Yeah, we're here with Dr. Syed Hussain from Trinity Health of New England. Always great to have you here. Really
Morning. Thank
important
you.
conversations. We're glad to have you here. And we're starting off with talking about breast cancer. And we have heard for so long, early prevention, early treatment is the best way to beat the disease. And every few years, it seems like the screenings change or shift a little bit. And a lot of people are concerned. They want to make sure they're getting their screenings, getting their mammograms when they're supposed to. So if you can break down any changes to the screening guidelines for us.
Yeah, great question. Thank you, Erica. So this is important. So the United States Preventive Services Task Force, that's USPSTF, just revised its guidelines on breast cancer screening for women. And so if your average risk, basically they now recommend from 40 years and above biannual screening, so every 2 years. That's still not consistent with what the American Cancer Society recommends, which is annual screening till age 55. But suffice to say, start at 40 and go all the way till age 74. And this is based on new data that the task force has reviewed, and it's an update from the 2016 guidelines that USPSTF had last updated.
And of course, depending on your family history, that might change depending on what your doctor says. Maybe your doctor's suggesting every year because of your family history.
That's right. If you've
to that.
100%. So that's a great point. So if you've had a prior episode of breast cancer, or you have one of those hereditary breast cancer BRCA gene, for instance, then your risk is high, and you would definitely need to have a discussion with your doctor on what the frequency of screening and when it should begin.
Right, and if you have a family history, it's important to consider getting tested for the BRCA gene.
That's right, absolutely.
Yeah. All right, moving on. Federal health officials say that 3 women tested positive for HIV after getting a vampire facial. If folks don't know what a vampire facial is, it's microneedling with PRP, that's platelet-rich plasma. It's taken from your own blood and then it's put onto your face. Talk about this, how this potentially happened, and the dangers of doing procedures like this.
Yeah, absolutely. So close on the heels of what we just saw a few weeks ago with health officials sounding the alarm on counterfeit Botox, where botulinum toxin was much higher in quantity and in dose than what it needs to be, and that led to health issues with certain people. So suffice to say here, what viewers need to remember, Erica, is make sure if you're getting a cosmetic procedure, especially an injection procedure, that it's with a licensed clinic, a licensed spa. These are unlicensed or pop-up offices where these folks are, at low prices, either injecting medications or doing these so-called vampire facials, which carries a risk. There's nothing greater than your health, and it's important that you keep that in mind and make sure you go to a licensed provider that is able to give these procedures.
I feel like even with licensed providers, you might just keep an eye on, make sure they're opening the needle from a sealed package, because that.
Yeah, the investigation here, that's a great point, showed reusing of
the
disposable,
to
absolutely.
take your blood, because initially you probably think, well, they were using their own blood. You
Yeah.
spin it, you put it back on your, but they may have been using a dirty needle to
That's right.
extract that blood.
That's right. That's right, which is a problem.
Yeah. All right. Well, moving on here, this next topic, very serious one. We're talking about teen vaping. A new study found that teens who frequently vape are exposing themselves to harmful metals like uranium and lead. So what do we need to know? What do we need to talk to our kids about doing this, and talk about the extreme dangers of these toxins?
Absolutely. So this study showed that frequent vapors actually had 30% higher levels of lead in their urine that was detected in this study, Erica, than those that are infrequent vapors, as well as uranium levels that were at twice as high in those that frequently vape. All pointing to dangers, especially in teens. We know there's almost 14% use in high school students with vaping. This is data based from 2022. So that's 14 million teenagers that may be using this.
Yeah,
and so this can lead to developmental issues. We know it can lead to breathing problems, heart disease, cancer risk long term. So, which basically means further research is needed in this area, but also more regulation.
All right, we just want to get this last topic in. We've been talking about it a little bit over the last few mornings. May is Mental Health Awareness, and the sunshine is coming out, starting to feel like spring. Talk about this new concept of sunshine guilt. We all want to get out there and enjoy it. And sunshine guilt is basically when you just can't do it, your schedule doesn't really allow it. It's almost like FOMO for the sunshine.
Yeah, so basically this is when you, for one reason or the other, you're not able to go outdoors and enjoy the sun, and you you develop guilt. You develop feelings of, fear of missing out, major fear of missing out.
I should have enjoyed this day.
Exactly, and instead of sulking, it's important that you think about why you're feeling that way. And there are plenty of things indoors that you can do as well. Or you might just need a nap, or catch up on some reading, or discuss something with a friend. But there are many other things that you can do so that you don't feel this guilt with a really nice day out.
Yeah, maybe you can't go play a full game of tennis, but maybe you can stand outside for 10 minutes and just get a little dose, right?
Right.
All right, better than nothing.
Yeah.
Dr. Hussain, thanks so much.
Thank you.
Really appreciate it.
Thank you so much.